Pelvic floor issues are a big problem for women postpartum, but a lot of people don't realize that those issues start during pregnancy, and you don't want to wait until after you give birth to do something about it. So today we're going to talk about everything you need to be doing during your pregnancy to protect your core and your pelvic floor so that your recovery will be faster and you'll just have a lot less recovering to do and a lot fewer potential problems. Hi, my name is Rachel Moises, a mother of 8 from the Mighty Mama movement.
And I'm Heather, a family nurse practitioner and midwife.
Okay, so I've had 8 babies, Heather's had 4. We've definitely dealt with these issues because it is, the more babies you have, the bigger problem that it becomes. But even for first-time moms, it can be an issue. So let's start out with, what is a pelvic floor? Do you want to take that one? An anatomy expert.
Yeah, so pelvic floor is basically all of those muscles that keep everything from falling out. So there are tons of, you have the levator ani and just multiple muscles. So they control with urine, they control the tone of our pelvic floor, and it's just so many muscles that all intertwine from the pelvis, from the abdominal walls, that just, they keep everything together. And it's interesting because you don't realize the muscles that affect the pelvic floor and how they affect the rest of the body.
Yeah.
So for instance, let's say you have an incision like an appendicitis, down low. If you try to scratch your nose, you can't, because you don't realize moving your arm.
Pulls on it.
Right.
Yeah.
You don't realize moving your arm. And so you just think, oh, it's just if I do my Kegels, And Kegels aren't a muscle, it's an exercise, right?
Yeah.
But we seem to think that they're Kegels, that like we phrase it that way many times. But all the muscles are interconnected in how they work, and it's very interesting.
Yeah, and a lot of the muscles are deep muscles. They're not on the outer surface. Like if you think of your abdominal muscles, the muscles that make you look like you have a six-pack, they're not even involved here. There's the transverse abdominis, which is another point. I'm not sure if you realize that your abdominal muscles are connected to your pelvic floor muscles. It's all one big ecosystem of muscles, okay?
Exactly.
Okay, Mama, quick mom-to-mom moment. I have to tell you this because I wish someone had told me. As you may know, I'm a mama of 8, and my first 3 births were rough. I just thought birth was supposed to be that painful. Nobody ever pulled me aside and said, hey, there's actually a better way. Then with my 4th baby, Heather, the midwife and nurse practitioner here, taught me something completely different, a method I had never seen in any book or video or internet research. And I ended up dialing to 10 centimeters with 0 pain. After 8 babies, I can honestly tell you this method works. Most mamas just never learn these strategies. Even if they want to avoid an epidural, they feel like they will cave once things get intense. That was totally me. I had done so much research, but I never found a real method that made birth actually manageable. And that's why Heather and I started teaching this, because birth does not have to feel like torture. So here's your little insider tip. We put together a totally free class for you. It teaches the most effective technique to reduce contraction pain and gives you a sneak peek of our full 10-step practically pain-free birth method. If there's even a tiny part of you that hopes birth could be easier, click the link below and grab your spot. Seriously, you will be so glad you did. A lot of women are told to do Kegels during pregnancy, and we're not telling you not to, but that's not enough. A lot of people just think, oh yeah, I do Kegels sometimes. So no big deal, I'm gonna be fine. There's more to it than that. Although let's talk what Kegels are and kind of explain that, and then we're gonna explain what else you need to do, because Kegels are barely scratching the surface of what you need to do to protect your core. We're not gonna take the time to teach you about Kegels. There's like so many ways to learn that, but basically it's just when you pull up your pelvic floor, you tighten it, let it release, pull up again. There's just one little tip that I wanna make about that. Everybody says the term to pull in your pelvic floor or tighten your pelvic floor, and that's basically the diplomatic, pretty way to say it. A friend of mine described it one time in a much more graphic way. I don't know graphic, but anyway, she said, what you need to do is think of tightening your anus. And I was like, oh, that's kind of a crass way to explain it. I think the right way to say is tightening your pelvic floor. But then I tried that, thinking in my mind of tightening and pulling in my anus. I used a lot more muscles. So if you try it thinking of that, you'll notice you're going to use the muscles from front to back and they're gonna all come pulling up in more. So might not be the most beautiful way to explain it, but I think it helps me to make sure that I'm engaging all the necessary muscles. Okay, so Kegels are good to do. Right. You can do them 10 at a time while you're sitting in the car, while you're watching a show, when you just ever think about it. It's good to do. It kind of keeps those muscles tightened up.
One thing I'd like to say about that is I found that if you recline back or laying down, you don't get the right muscles. I found that I have to sit up straight to really engage those pelvic floor muscles. That if I lean back, for some reason, I can't engage them as strongly. But if I'm leaning forward like this, I can really get a good grip on those muscles. And so that's one thing, is try it leaning back, reclining, kind of slouch and try it. And if you slouch, you'll get more of your butt muscles, not the pelvic floor as much. But if you sit upright, you'll get more pelvic floor and less butt.
Yeah. And if you do it lying down flat on your back too, you can kind of think of pulling your hips up towards your ribs. And that's kind of the movement that you're wanting to make there. So moral of the story, do Kegels. They're great. Let's talk about what else to do.
So Kegels are just some of the muscles that are involved. As we talked about before, there's a whole play of muscles here. And I like to use the example of your biceps. You would never just exercise your biceps all day long. You do your biceps and then you would do your triceps, right? So you're going to exercise the opposite muscles as well to strengthen the other side. And Kegels are definitely a core, but if you only strengthened your Kegels, that can weaken the other muscles and pull things different because of one muscle being strong and the counter muscle being weak. Just a quick example. I remember I was having stress urinary incontinence, had 4 children. Gotta love the joys. And so I went to an OBGYN and to help with the GYN part. And he says, oh, I know what the problem is. I know what the problem is. We're going to do this. So he does an exam and he says, okay, tighten around my fingers, do a Kegel around my fingers. And I'm thinking, dude, it's not that. I have really strong muscles that make that Kegel response. But, he wouldn't listen to me. You know how it is. And so he does the exam and he's like, okay, tighten your muscles. And I tighten him. He goes, oh, that's not the problem. And I was like, yeah, I know. That's why I'm here. So many women, that can be the problem, that tightening of those pelvic floor muscles. But in my case, it wasn't. And we had to find out, okay, what muscles are super tight or what muscles need to be strengthened. And that's where the pelvic floor specialist really helped. And so that's a beginning point, but it's not the solution for everyone.
Yeah. So do those throughout pregnancy to help that, but you have to work on all the core muscles. Now, we have an easy way for you to do this because we actually have a program of exercises that you can do. You've probably heard of diastasis recti. This is when you have that ab separation and the weak pelvic floor. Usually they're talking about it postpartum, but you get it during pregnancy if you do. And if you do the same exercises that help heal it postpartum, but you do them through pregnancy, it will strengthen all of the right muscles in the core and the pelvic floor to really reduce your risk of having to heal it afterward, which is so nice because it does take quite a long time to heal it. When I say exercises, it's more like physical therapy exercises. And I mean, if you're already postpartum, even if you're postpartum like a lot of years, you had your baby a long time ago, but you're having incontinence, back pain, a separation in your abs, all of those issues, you can do this anytime. But if you do those exercises during pregnancy, they're going to help just avoid dealing with that recovery in the first place.
Well, and women who have those weak muscles, because the uterus comes up and it separates the rectus diaphragm, and you get that diastasis kind of, that separation. Yeah. And it usually goes back within 6 weeks to about, a finger breadth part in those muscles, which is what you want. That's fantastic. But when they don't come back because we have ignored them, not paid attention to them.
You basically have an injury.
Right. And the only way to sometimes to bring them back is a tummy tuck. And because a tummy tuck, what it is, we think of it's tightening the skin, but that's a real tummy tuck is lifting the skin up, taking those abdominal muscles and suturing them back together so that our organs are protected and not exposed. Like if you were to get punched, protecting it. And that recovery, from what I hear, is brutal. I mean, it is 6 weeks hardcore, basically bed rest.
Oh, wow.
And women have said it's brutal, the recovery. They said it was worth it to get their muscles back together. But they said if they'd have known the exercises to do beforehand, they absolutely would have done that first, because of how difficult it is.
And expensive. It's
my
not
goodness.
a procedure that insurance will
and
usually
you can't
cover.
take care of your children. So you're not doing it with a 2-year-old.
Yeah.
You're waiting till that 2-year-old is 16 and can basically take care of themselves. You're not doing this with young children. So these preventative measures are not just, this would be a good thing for you to do. This is stopping you from having exposed internal organs and potentially needing a tummy tuck to bring everything back together. Many women that get a tummy tuck, it's not a vanity issue.
Yeah.
Though it does, help you to look
it's
nicer.
Nice,
But it is a posture issue, back aches, shoulder aches.
Is a big issue.
Absolutely.
Like can't go running, can't jump.
Yep. All
can't
of that.
Sneeze too hard.
It affects everything from headaches to, like you said, stress urinary incontinence, and bringing it all back together to protect those organs and improve your posture and everything. But it is not an easy surgery.
Yeah.
I would much rather do these exercises.
And I will say that I had a 4-finger width gap for my diastasis recti after, I had 8 pregnancies. That's pretty significant. That's a big gap, a big injury. But doing those exercises was enough for me to bring it back together and close that on my own without needing surgery. But like I said, it takes consistency over a very long time once you've been injured that bad. Like, you definitely want to avoid it. So another thing that you need to do, and I wish I had been proactive during my pregnancies, because even though I had 8 pregnancies, it doesn't mean that I had to have that pretty serious diastasis recti after them. I could have been doing the exercises during my pregnancies, and I could have been careful in other ways. So one of them is simply, when you get up from lying down, you do not use your abdominal muscles to pull you up. I did this. I never adjusted my...
While pregnant?
Yeah, while pregnant. I never adjusted my movements and my behavior because I just had an attitude of like, I'm strong, young, and healthy. I don't have to do anything different. That was so dumb. You've got to, if you're lying down, you want to come with your arms, push yourself up into a sitting position, and then with your hands, sort of push yourself up, right? Never use those abdominal muscles to pull yourself up. Does that make sense?
Yeah.
Because that puts strain on the separation. You have to remember, your abs are being stretched out like this big, and they are being pulled apart inevitably. You can't avoid that. But you don't need them pulled about more than necessary, and you need to keep those tissues strong. And so putting that extra strain beyond what you already have is just such a bad idea. So that's one thing that you want to do throughout your whole pregnancy, and be careful about it every single time that you get up. Another thing you can do throughout your pregnancy is breathing correctly. I know that's like, what? But when you breathe, if you think of pulling in your abdominal muscles, kind of like a corset, and breathe that way, breathe through your diaphragm, that helps protect, and it actually can help heal those muscles as well. So if you breathe diaphragm breathing and kind of low down and pulling in throughout your pregnancy, it's a really good thing. If you're lying in bed, you can take some really deep breaths. You just breathe in, and then as you breathe out, pull those muscles in. You can do that in conjunction with Kegels, or do Kegels like 10 of them and do 10 of those deep breaths where you pull in, because that's the deep sort of corset abdominal muscles, and that's what you want to be strengthening. So that's a really good thing to do in conjunction with the Kegels throughout your pregnancy.
And one thing that most people, it seems like, breathe with the upper lobes of their lungs. They don't really fill up the lower lobes with air. And so when I have somebody who's like, the average breathing is 20 or 12 to 20 breaths a minute, right? When I have someone that's breathing 30 breaths a minute, they're breathing with just their upper lobes, or And someone that has a respiration of 12 breaths a minute, typically they're using their diaphragm like you talked about, but they're filling the lower lobes with air. If you've ever had surgery at all, you can get pneumonia by not filling up the lower lobes with air, and fluid will accumulate in the lungs. And that's why they have you breathe in on those, I can't remember what they're called, I'm sorry, but on the little machines that you breathe in and then you blow
and you
out.
See the little
yes,
ball?
And the spirometer, that's what it is. Sorry. And by the breathing in and filling the whole lungs and then breathing out, you're exercising your diaphragm and getting it moving again, but you're moving air and expanding all of your lung. And so a lot of yoga and meditation talks about really breathing in like you just talked about, because you're filling your lungs all the way with air, and then you're breathing out, you're exhaling, and really moving that bad air, that air that has done the whole blood oxygen gas exchange. We're getting out the CO2, we're breathing in, and we're getting this, all done properly, and not just, but real deep breathing. And that's very healing for the body too.
Right. So there's a lot of benefits to do that. I mean, really, during pregnancy, you need as much calmness and relaxing as you can. And then also, if you're keeping those muscles tightened,
yes,
it's really good. Okay, another one is the bathroom. So constipation can be a problem when you're pregnant. It's very common. It doesn't matter if it's early pregnancy. There's different reasons that cause it in early pregnancy and later in your pregnancy. That is an issue. You can't be spending too much time on the bathroom. I mean, obviously you don't want hemorrhoids, so that's one issue there. It's not good for your colon either.
Right.
But today we're talking about your core and wanting to heal your pelvic floor. You have your uterus has a lot of fluid in it. It has a growing baby in it. It has a placenta. It's heavy.
It's a lot of weight.
You can feel that it's heavy. I don't have to tell you that. You don't want that pressing down. When you're sitting on the toilet, it just allows that to push down on your pelvic floor, right?
Yes.
And that's going to cause damage if you're spending too long on the toilet. So I don't know, what do you do instead? Make sure.
Definitely making sure that you have your bowels moving. I always tell people, if you eat 3 times a day, you should have 3 bowel movements a day, at least 2. And when people say, oh, I have a bowel movement twice a week, I'm like, unless you're eating twice a week, that's not normal. You should never poop rabbit pellets, deer pellets. They should be nice and formed. And the more formed and looser they are, the less likely you are to get hemorrhoids, the less likely you are to sit on the toilet longer, the more comfortable you're going to feel. And you're also getting those toxins out of your body. And the liver is so congested in pregnancy. It has to work extra hard for you and baby. And if we don't remove those toxins every day from our bowels, that's going to cause other issues. But with hemorrhoids are so big, such a big problem in pregnancy. And it's typically from constipation and just sitting on the toilet and letting everything just hang out. We want to do that for a short period of time, but not for 30 minutes or,
even more than 5 minutes.
Exactly.
If it's not ready, it's not ready.
Exactly. And you shouldn't have to really strain, because that's going to cause the hemorrhoids. So we want this all to be a natural flow, and it relates to, all the muscles there, just so many problems.
Yeah.
We're talking on the pelvic floor.
Right.
But, oh my goodness.
It's all related. So avoiding constipation in the first place, which we're talking about eating more fiber, drinking more water. A supplement I love to recommend is Dr. Christopher's Lower Bowel Formula. That's really good to just help. It's an herbal, natural sort of laxative.
It helps the peristalsis of the intestines.
And it's supposed to help the lining of the intestines as well to be healthier. So
magnesium is really good. So many people are deficient in magnesium. I personally don't recommend a lot of the over-the-counter medications for it, because they're meant as a very short-term quick fix, like a 1 or 2 day fix. And people use them for weeks or months or years, and the body gets addicted, and you won't have a bowel movement without, DocuSate or without these over-the-counter remedies that your body just becomes addicted to and
Right.
can't function without them. So the herbs and the nutrients like the magnesium and stuff, the body needs those and it helps move them along. A lot of people think that, I mean, fiber is good. Fiber helps. But if you have blocked bowels and you take fiber, all you're doing is bulking up. You're not moving it along. You've got to move it along before you can move to the fiber.
So the fiber is more of a continual, be consistent type of a thing.
Exactly.
Yeah. And then, of course, walking. I mean, we didn't mean to do a whole video on constipation, but
but it's all related.
You know, walking, staying healthy, and all that. And then one more tip. Probably everyone knows this, but if you feel the urge to go, you've got to stop what you're doing and you go then. Do not hold it in, because I mean, for me, I sometimes, I'll be like sweeping in the morning. I'm like, oh, gotta stop sweeping. It's time to go to the bathroom. Like, you gotta stop. My brain is not good at that. I like to finish what I'm doing.
Yes.
But you've got to train yourself that the moment you feel like you need to go, you stop whatever you're doing and you head straight to the bathroom. And that will help, and it will cause problems if you don't do that.
Right. And because remember, we're not dealing with the non-pregnant body. We're dealing with the pregnant body, which changes the rules of the game. You know, normally we want to train our bladder to not have to go every hour. You know, we want to train our bladder to ignore the sensations for a bit so that, you know, we're not making a road stop every hour. But when we're pregnant, the rules of the game change, because you have something sitting on your bladder, a very heavy something sitting on your bladder, and your bowels, that can cause a lot of problems if they back up in pregnancy because of the relaxin hormone and how it stretches everything. And so pregnancy really changes in not just in this, but in exercise and so many things. And so you may say, well, why are they telling us this? You know, wait a minute, I thought I was not supposed to eat 8 times a day. And, you know, and we're telling you to eat 10 times, because pregnancy changes the rules. Okay. So please keep that in mind with a lot of the stuff we're telling you.
And just to wrap up this lovely topic, we don't want to do any bearing down or straining on the toilet. Okay. So I think we kind of mentioned that, but it's really, really important. If you find that you're having to do that, you need to stop, do something else to help things get moving, and wait until you feel that urge and the need to go to the bathroom, and you'll be able to get that out. That's so bad for so many reasons that we already talked about, but it makes it so much worse than just sitting there is not good. But then if you're also bearing down, extra bad. So none of that. Okay.
Right.
All right. Another thing you need to do during pregnancy to protect your core and your pelvic floor is good posture, which is so hard when you're pregnant. So a really common problem with posture during pregnancy is tilting your pelvis. Is this called tilting it forward? Okay, so when you're leaning back in a chair, if you were to see your pelvis, it would look like the bottom is sort of pushing up, it's tilted up, and the top is tilted back. Okay.
Right.
When I'm sitting like this right now, I can feel some strain on my lower back. It doesn't feel very comfortable, but at the same time, I used to sit like that a lot because I wanted to keep my shoulders back, because of all the years of nursing and being on a laptop, I have a tendency to be kind of hunched over. So I tried to solve that problem by leaning back a little bit to keep my shoulders back, but then that tilts my pelvis in the wrong position. And even when I'm not pregnant, that's a problem, because it can cause lower back pain and misalignment and everything. But when you are pregnant, it's worse, because this increases the strain on those abdominal muscles. It can put baby in a bad position, and that's not something you want, because birth is much harder to manage and to get through if your baby's in the wrong position. We talked about back labor. Everybody knows that back labor is the worst. That's because usually mom has been spending a lot of time in that sort of leaning back position.
Well, and another thing is, if your pelvic floor is not toned, baby can get in like an asynclitic. And what asynclitic is, baby's head down, maybe baby is facing back the way we want them, but their head is kinked to the side. And a toned pelvic floor will help baby just line right up with the birth canal.
Oh, okay.
And a relaxed pelvic floor, bad posture in mom can cause posterior babies and babies to kind of engage in a weird angle. And that can result in Pitocin, for stronger contractions, C-sections, much, much longer labors, harder pushing, more tearing. And so once again, it all ties in together, that it's not just, oh, is baby head down, but is baby head down and what we call anterior, meaning the back of the head is towards mom's front, and is baby's head lined up, perfectly, or is baby crooked? And your posture, your muscles, the way you walk, everything determines that. So these things that Rachel is talking about here, that we're talking about, are so important for pregnancy comfort, to avoid backache and shoulder ache and all of these different pullings, but also for the day of birth as well.
And then for your postpartum recovery. So we're not trying to overwhelm you and be like, you have to do this and this and this. But I guess it's the classic case of making things a little bit harder up front actually makes a lot of things easier later on. You know what I mean?
Yep.
If you are just careful about your posture, if you want to lie down and relax, you can, but do it other positions. Do it on your side where you're supported, just don't be having your pelvis tilted like that, okay? Find a different way to be comfortable. When you're driving in the car, something that helps me a lot is to think of pushing my lower back all the way to the back of the seat, because I tended to also sit poorly in the driver's seat. So it helps me sitting in any chair, but I'm, in the car, I'm sitting there a lot. With my lower back pushed against the back of the chair, that's gonna just have everything aligned how you want it. It will keep your shoulders how you want them as well, and everything else. So that's just a little tip when you're trying to keep your posture. And so many women complain of back pain in labor, in pregnancy. A lot of that can be avoided, and that will also help with all these other things. So I think it's worth the effort.
Definitely. And you may not feel it with your first pregnancy, especially if you're young with your first pregnancy. You won't feel a lot of things much because the younger body is typically stronger. But, by your second baby, third baby, I know by my fourth baby, I was miserable. I was so miserable. And looking back, I wish I would have paid more attention to these things and really toned them before I became pregnant. And then while I was pregnant, because it really was hard on my body, that fourth pregnancy. But I look at that as some of that was my own fault, because I didn't do these things. I didn't even know about these things, to be honest with you. And that's why we're teaching you, so that you know about these things. One of the advantages of Rachel and I having had many children together is we can say, I wish I would have known this. And we talk to each other and we're like, okay, what do we wish we would have known that we can pass on to these moms?
That's the theme of our channel. I think what we wish we'd known, our life would have been easier. Okay, so we covered a lot of things. I want to just make sure you understand everything that we're saying. First of all, while you're pregnant, protect your core. So be careful with your movements. Don't use your abs to pull yourself up. Have good posture. Breathe from your diaphragm. That's just sort of small daily habits that you have to work on, and just do as often as you remember them. The other thing is we strongly recommend doing some type of core workout that is diastasis recti friendly. Okay, I'll link below to a program that we have. It's really inexpensive, and we made it specifically for all of the movements, the exercises you should do. What you do for this is you just take 10 to 15 minutes out of your day to lie down on the floor, and you do some core exercises, kind of like physical therapy. It's not physically demanding. It's not difficult. You just have to take the time to do it. And if you can't do it every day, but you could do it 2 or 3 times a week, that is going to have, I think, the biggest impact of all the things we're talking about, to just help that core, all of the right muscles, stay strong and toned, and really reduce your likelihood of having issues during birth, having issues postpartum, or having the really common back pain and other issues that you have during pregnancy. So check that out, do that, and then be careful about all those daily habits that we went over. And then one last thing, I will also link to our free online birth class called How to Give Birth with Practically No Pain. As you can see, even protecting your core is one aspect of contributing to having a low pain, smooth birth, but there's a whole lot more that you need to learn, and that class is free. So check it out and start preparing for your birth to have a low pain, happy, wonderful birth experience.